Welcome back to another episode in this particular podcast, ladies and gentlemen. I'm sitting and having a conversation with the legendary Dr. Sunil Bhat. In the previous podcast episode, we talked about bone marrow transplant and Narayana Health City as a whole. But in this particular episode, we're going to dig deeper into thalassemia-focused questions. This is going to be extremely important, extremely knowledgeable, and extremely important for the sake of you building awareness about this particular topic. Because until and unless you build awareness about something, you wouldn't know how to treat it, right? I'm excited for you to listen to this particular conversation. Let's get right into it. In this next segment, I want to get down to spreading a little awareness about a few things.
Right.
It's very important for people to know and be aware of the things around them, for them to be able to seek solutions for the same, right? So I have a few questions around thalassemia.
Right.
I hope I'm pronouncing that right.
Yeah. Thalassemia is correct. Yeah.
All right. So thalassemia patients, they require repeated blood transfusions, right? Why does this lead to iron overload in the body? What do you think?
Okay. So let's start it. I'll go a step behind.
Got it.
So thalassemia, we're the thalassemia capital of the world, which we're not proud of, actually. Right.
Just for context,
Yes. So thalassemia is a genetic disorder,
all right,
wherein you have these children who are born with a genetic defect. So we have two genes which make blood pulse.
right.
Like we have two kidneys for, making urine, you have two eyes to see, you have two nostrils, breathe. So similarly, there are two genes to make blood.
Right.
And if both the genes are abnormal, that means you won't be able to make any blood, because the machine is not working here, so capacity to produce blood is not there.
Right.
As a result of that, these children, after third, fourth month of age, they require blood transfusion to sustain, because they're not making any blood of their own, and that continues lifelong.
Got it.
The only way to cure them is transplant, but otherwise, if you do not, they will require lifelong blood transfusions. Now, how it comes from? It comes from the parents. Both the parents have one gene normal, one gene abnormal.
Okay.
But because they have one abnormal gene and one normal gene, they still make normal blood. They don't know they have a problem.
Oh.
So they're unaware of the problem. And when they marry, there's a chance that your children, both bad genes can come together and lead to something called as thalassemia in their children, and then consequently they require lifelong blood transfusions.
Oh.
Now, blood is lifeline for them, right? Without blood, they cannot live more than 1.5 to 2 years of age.
Very true.
And it has to be given, as I said, lifelong. But blood has its own problems. Blood has got two major problems. One is that blood is very rich in iron.
Oh.
So when you give somebody blood transfusion every 3-4 weeks, the amount of iron they get with blood is huge. They get absolutely every unit of packed cell, or we call it blood unit, gives around 200 milligrams of iron.
Wow.
To someone every 3-4 weeks. That's one problem. And the second problem is, of course, infections. Blood can transfer infections to the blood, like HIV, Hep B, Hep C. So
absolutely,
you must have read some news articles recently where children with thalassemia, because they have to get regular transfusions, and they got infected with Hep C and Hep B and all that in some parts of the country. So the second problem.
Right.
So coming to the first problem, which you just mentioned, as iron overload. So iron overload is part and parcel of blood transfusion. You can't do anything about it. This is unfortunate for those children. Why? Because God has got no mechanism built in us where we can excrete iron, excess iron from our body. It comes in, it's a one-way traffic. Iron goes in, doesn't come out.
Yeah.
And that was good for us, normal people, because we get very little amount of iron from our diet. So God wanted to preserve this iron in our body and not let it go out. And that becomes a disadvantage for these children. And this iron now, it gets overloaded in the body, and that it can damage organs. It can damage heart, it can damage liver, it can damage hormonal glands in the body, and that can lead to problems. And hence, iron overload is a significant problem in thalassemia patients because of the regular blood transfusions they are receiving. And only way to address it is to give them iron chelation medicines.
Yeah, that's exactly was my next question.
Right.
Please.
So we can prevent it by iron chelation. So iron chelation is the medications they need to take regularly to get this iron out of the body.
Right.
It is not coming by itself. It has to be removed.
What is the process of this?
Iron chelation is medicine. So there are 2 or 3 medications which are used to take iron out of the body. A couple of them are oral medications. We call it Defricerox. Some they call as Kelper or Defripron. These are to be taken orally. These are to be taken by mouth. And there's also an injection version which can be given through IV or subcutaneous under the skin. Those are given to reduce or remove this iron from the body.
Got it. So, like, at what age is BMT ideally preferred for thalassemia patients?
So, see, as I said, thalassemia, the only cure for this condition is two. Actually, one is bone marrow transplant and one is something called as gene therapy.
Gene therapy.
Gene therapy,
Okay.
yes. So we can correct thalassemia with gene therapy also. It's approved for gene therapy is also approved for thalassemia now. But unfortunately, gene therapy for thalassemia is not ever in India at this point of time. I think we are working towards that. It may take another 3-4 years. It's available in few centers in the world, but extremely expensive, very expensive. Like $2 to $2.5 million just to make the gene therapy and then additional, for the treatment part. So it's extremely expensive.
Correct.
Which is Indian rupees comes to around 2 to 25 rupees for the treatment. It is extremely expensive. So let's not talk too much about it because it's not available at this point of time. But bone marrow transplant is fine. It's available. It is being done for thalassemias, and we have been doing it for a long time now, almost a couple of decades in India as well. But the age is a very good question because a lot of parents ask this, although they are diagnosed at 3-4 months of age, and we tell them this can be cured with bone marrow transplant, they start inquiring about it.
Right.
But we always try to do transplants in thalassemia only after 1.5-2 years of.
Okay.
Till that time, we maintain them on blood transfusions and other medications, which I was just mentioning earlier.
Got it.
And that's for a reason because, if we say infant, less than 1.5 year of age, it's a little difficult to manage them. Why? There's no rush in thalassemia. There's no emergency in thalassemia. They have to transplant them the same day.
Right.
So let them grow a little bit more.
Right.
And second is, infants, they do not tolerate some of the treatment as well as older children. So hence, younger the better, but 1.5 to 2 years is when we start.
As I said in the beginning of this episode as well, that until and unless you know everything in and around your life, you wouldn't know how to navigate through that particular situation, right? And that is why building awareness is very important. And that is exactly where people like Dr. Sunil Bhat come into the picture. Why? Because the kind of knowledge that they have, through which I, for that sake, am able to get to know so much more about thalassemia, for that sake, it's incredible. And I hope that you feel the same as I'm feeling as well. I am genuinely very excited to bring you more episodes from this particular conversation that I'm having with Dr. Sunil Bhat. Until the next episode, stay tuned.